Treatment Protocol C Polarization of the patient's body planes. The next step of the treatment protocol is the polarization of the patient's biomagnetic axis or body planes using a magnetic rod. This rod has one end with negative polarity and the other end with positive polarity. The body cells should be polarized in an organized manner. That is, the cellular links that connect a negative pole in one cell with a positive pole in the next cell should be well sorted and organized. That's what happens when a person has a very healthy lifestyle, when his diet is adequate, his mind is free from conflicts, he practices meditation, and so on. When there are conflicts, shocks, or diseases that alter the body's pH, the polarization of cells is altered, and these bioelectrical links get disorganized. Many people have experienced, for example in situations of extreme fear or disgust, a sensation similar to an electric shock in our body, and then just after that we had a feeling of unpleasant tranquility. The polarization of our cells has been upset and disturbed by this situation. When we do the magnetic rod polarization, we get the cells to properly reorganize along the three body planes that we will see. When the patient's body cells are properly polarized, the scanning magnet that the therapist uses can detect with fidelity and accuracy the pH imbalances of the biomagnetic pairs that cause the patient's illness. The acid points will really reflect being acid, and the alkaline points will really reflect being alkaline. However, if the patient's body cells are not properly polarized and organized, there may be points that mark being acid when in fact they are not, or even when they are alkaline. Similarly, there may be points that mark being alkaline without being really so. And then the therapist may find during the scanning many unbalanced pairs that are actually false positives. In this case, the diagnosis will not be correct and the therapy will not be as effective as it could have been. Conversely, if the therapist will scan having previously polarized the patient's body using the magnetic rod, he will discover fewer unbalanced pairs, but none will be a false positive. The body has three biomagnetic axes or planes, dividing it into different segments. These three axes pass through a point slightly to the left of the sternum, between the xiphoid and the left breast. Before beginning to scan, the therapist must polarize and normalize these three planes as follows. Vertical plane. The therapist must first put the center of the magnetic rod at the point between the xiphoid and the left breast in a vertical direction, and the negative side pointing upwards and the positive side pointing down. Then the magnetic rod must be rotated 180 degrees, that is vertical, but this time the negative side of the rod pointing down. Horizontal plane. The therapist must put the center of the magnetic rod at the same point as before, but horizontally this time, and the negative side pointing left, that is, the patient's left, and the positive side pointing to the right. Then the magnetic rod must be rotated 180 degrees, that is horizontal, but this time the negative side pointing to the right. Anterior-posterior plane. The therapist must put the center of the magnetic rod at the point corresponding to the spleen, following the anterior-posterior direction, and the negative side pointing forward and the positive side pointing backwards. Then the magnetic rod should be rotated 180 degrees in the anterior-posterior direction, but this time the negative side pointing backwards. The polarization of these three planes occurs instantly, as the magnetic field of the rod affects the cell at the speed of light. It is not necessary that the point at which the magnetic rod is placed is as accurate and precise as it is, for example, in the case of acupuncture points. It is not so important here. It is not even necessary that the rod physically touches the patient's body, because the magnet has a magnetic field acting in any case from a distance from a few inches at least. We have seen that it is useful to polarize the body planes to make the diagnosis more effective. But polarizing the body's cells with the help of the magnetic rod offers the great added benefit of eliminating free radicals. It is therefore advisable to use the magnetic rod regularly, especially after meals and after moments of stress, fear, sadness, etc. It is good practice to polarize our three body planes every day as a habit, without requiring necessarily any therapy session. Most likely, polarizing us will do much good. And although we did not need it that particular day, that would not do any harm at all in any case. Considering that it only takes about 15 seconds to polarize the three planes, we strongly advise the therapist to do so systematically in all patients. This polarization is an important part of the treatment protocol of biomagnetic therapy. Once the patient's body has already been polarized, it is ready for the next stage of the protocol, which is the complete scan of the patient using a negative magnet.